Should the National Health Insurance Bill be accepted into law, it will have far-reaching consequences for South Africans. It is a comprehensive bill that aims to completely communise the healthcare industry in the country. But what will this mean for ordinary people? You will have to become a member of the NHI. In effect, it would mean that the government will have the power to decide what treatment you need, who should provide it, and where you should obtain it. Contributions will be pooled in a central fund. Because he will have the power to appoint the fund's council, the Minister of Health will essentially have total control over the NHI fund. Taxpayers will have to foot the bill. About 8.3% of the population will be forced to fund the NHI on behalf of the whole country. You will have to register with a certain healthcare provider. This would mean that you will have to register with a certain house doctor. The number of visits you are entitled to may also be limited. The government will have access to your medical information. If you break the rules, you won't be covered. Moreover, you will not have direct access to specialists such as oncologists and gynecologists. A range of medical services, treatments and procedures will be covered. The fund will not cover the treatment, however, if it isn't medically necessary and where there won't be a cost-effective intervention. The government will decide which doctors may offer their services under the NHI. This will probably lead to a mass exodus of trained medical personnel in South Africa, who will be able to determine their own prices elsewhere. The government will determine what medical services would cost. The government will annually determine prices for specific services. These prices will then determine what healthcare providers will be paid. The government will buy medicine for everyone. The fund will also have the power to decide which medications each of its fund members will be able to use. Medical schemes will most probably disappear. As soon as the NHI is fully implemented, medical schemes will only be able to offer additional cover. The bill can still be opposed. Despite the government's promises, the NHI is not the answer to the country's health problems. Help AfriForum fight for your health. SMS HEALTH to 45352.